Hey, it's Dr. Cody Rall with Techforpsych. Today we have a Psychiatry Innovation Lab pitch and interview with Team Psychiatry, who's developing a hands-free audio detection and alert system for domestic abuse victims. Team Psychiatry took home the Audience Choice Award for $1,500 at the Psychiatry Innovation Lab in San Diego.
My name is Patrick Yu. I studied master's degree at NYU in music technology.
Hello, my name is Kyu Oh. I'm a second-year medical student at Icahn School of Medicine at Mount Sinai.
My name is Joon Park. I study economics at NYU.
My name is Vanessa and I am studying psychology at Columbia University.
Hello everyone, we're Team Psychiatry and we are really passionate about solving the problem of domestic violence. And we have a truly multidisciplinary team here. I am Kyu, and I'm a medical student. And this is Vanessa, who's a psychology student, and Joon, who studies economics PhD and now in charge of our business model, and Patrick with master's in music technology in charge of our audio detection technology. So domestic violence and mental health is very closely intertwined. Domestic violence victims are much more likely to develop PTSD, depression, suicidal ideation, and substance abuse. Also, domestic violence is a very prevalent problem in today's society, affecting 1 in 3 women and 1 in 4 men. Let's think about a hypothetical victim named Alex. Alex has been suffering continuously from the physical violence of the abuser. A challenge for victims like Alex, however, is that when the abuser starts getting really violent towards her, it is very difficult for Alex at the moment to grab her phone, dial the number, or call 911. Therefore, this can result in severe underreporting of domestic violence. And the solution that we propose here is Psychiatry, which is a hands-free audio detection and alert system. We have a fully automated system, therefore it means that the victims are not required during the whole process to manipulate the phone. Also, unlike other competitors in the market, such as Aspire or Revolar, we are the first product in the market that utilizes such an audio detection technology. And by using Psychiatry, we believe that it can also benefit both victims and abusers, and this point is going to be further elaborated by my partners.
Okay, so Psychiatry works in 4 easy steps: on, detect, alert, and intervene. Alex, our victim, can turn on Psychiatry application and its detection function. Psychiatry continues to run even when the screen is off. When detection is on, Psychiatry passively searches for sounds of violence or Alex's keywords. When the input signal contains such components, Psychiatry detects and starts recording and storing the audio data for the future references. This is what's unique about Psychiatry. We're bringing in this audio detection technology, which has been extensively studied for years in the field. Psychiatry uses feature extraction and classification methods to identify such sounds of violence, such as gunshots, screaming, or glass shattering. To date, detection accuracy is highly reliable. Back to our story, once Psychiatry detects Alex's danger, it automatically alerts her safety contacts, which can be her friends, family, or hotlines. The abuser can also have accountability partners who can help the abuser stop. Finally, Alex and the abuser get intervention, and Alex is now safe here.
Psychiatry has positive impacts on victims, abusers, and healthcare professionals and scientific society. Victims can feel safe and break the power and control cycle, and abusers can get feedback to modify their behaviors, and healthcare professionals and scientific society also can get benefits from recorded patterns of domestic violence more in detail. For social impacts, Psychiatry can increase reports and intervention rates, prevent repetitive domestic violence, and help investigation by providing stored data. In long term, this can result in reducing a huge amount of social cost of domestic violence, which exceeds $8.3 billion.
Okay, so we have a nonprofit business model, and we plan to cooperate mostly with government agencies and domestic violence shelters. These agencies or mental health care professionals will refer our product to the victims, and in return, we will charge these agencies for the user's license. License charge will be based on the number of victims utilizing our product. However, victims will not have to pay for our service. Another channel is the education program for domestic violence abusers. Oftentimes, abusers are mandated to complete education programs, and Safe Here will allow these abusers to monitor their behaviors. And this is our next step. Thank you.
I'm a second-year medical student at Icahn School of Medicine at Mount Sinai, and I'm really interested in going into psychiatry, so this is a really good opportunity for me. I'm so excited to be at APA conference and to be a part of Innovation Lab. So Vanessa and I was in charge of organizing a mental health event in Columbia University, and we had a little class about mental health first aid taught to Columbia students, and LNO came to the session and let us know about this amazing opportunity. So Vanessa and I was definitely on board after hearing about this. At first, Patrick brought up with this amazing idea of having an audio detection technology, and I was the one who thought about implementing it into a domestic violence situation. I have an experience at volunteering at Rhee, which is a sexual violence network, and when I was volunteering, I saw a lot of domestic violence cases and how much it was underreported in many cases because they were so isolated and so controlled by the abuser. And we thought having this automatic audio detection technology can really help with the victims. So that's how Safe Here began as a domestic violence project.